Millions of Americans began this year believing nothing had changed. Their job was the same. Their income was the same. Their health insurance plan looked the same. But something critical had already shifted beneath the surface. Without a press conference, without a national warning, a major piece of financial protection quietly expired. And now, families across the country are discovering that the cost of staying insured has changed dramatically, even though their lives have not. This is not a glitch in a system. This is the system, doing exactly what it was designed to do when support disappears. For several years, a specific healthcare subsidy kept the individual insurance market from breaking. It reduced monthly premiums. It capped how much income families had to spend on coverage. It prevented sudden price shocks. More than 20 million Americans relied on it, not as a bonus, not as a luxury, but as the difference between being insured and being exposed. Then the subsidy ended, not because healthcare became cheaper, not because wages suddenly rose, not because medical costs were under control. It ended because it was temporary. And temporary solutions always carry permanent consequences. What followed was immediate, even if it wasn't visible. Insurance companies recalculated prices. Market rules reverted. Cost caps vanished. And the true price of American healthcare began to surface again. For the average person buying insurance on their own, yearly costs jumped sharply. What once felt barely affordable suddenly felt dangerous. Premiums that had been kept in check for years began rising by amounts people rarely plan for. Hundreds of dollars more each month. Thousands more over the year. And this is only the beginning of the story, because averages hide the pain. Behind those numbers are families facing much steeper increases, especially older Americans. Health insurance pricing increases with age by design. So when subsidies disappear, the impact is not gradual. It is explosive. People in their late 50s and early 60s are experiencing the sharpest increases. Too young for Medicare. Too old to recover financially from major medical debt. For them, premiums can consume a staggering share of household income. And even after paying those premiums, deductibles remain high enough to discourage care, which creates a dangerous illusion. You are insured on paper, but functionally, you are still one illness away from crisis. This is not a fringe group. Millions of Americans rely on the individual insurance market. Self-employed workers, small business owners, freelancers, farmers, early retirees, people who power large parts of the economy yet operate without employer-sponsored coverage. For them, the insurance marketplace is not optional. It is the only option. And now, that option is becoming unstable. When healthcare costs rise this fast, behavior changes in predictable ways. People do not immediately abandon coverage. First, they try to adapt. They postpone routine visits. They ration prescriptions. They delay tests. Then comes the breaking point. Analysts project that several million Americans will lose coverage entirely as a result of these changes. Not because they do not value insurance, because affordability collapses. And when healthier people exit the system first, which they almost always do, the consequences multiply. Insurance pools become sicker. Costs rise again. Premiums increase further. This is the feedback loop economists have warned about for decades. Once it begins, it accelerates. Even people who remain insured end up paying more. This is how insurance markets destabilize without a single dramatic collapse. Hospitals are already preparing. When coverage declines, emergency room visits increase. Preventive care drops. Late-stage diagnoses rise. The cost of healthcare does not disappear. It shifts from manageable treatment to emergency intervention. And emergency care is always more expensive. Families feel it through medical debt. Hospitals feel it through unpaid bills. Communities feel it through reduced access. Rural healthcare systems are especially vulnerable. Small hospitals rely heavily on insured patients. When coverage drops even slightly, margins vanish. Across the country, rural facilities are already operating at the edge of survival. Closures do not happen all at once. They happen quietly. A department shuts down. Then staffing is reduced. Then the facility disappears. When that happens, entire regions lose access to care. Travel times increase. Outcomes worsen. Lives are shortened. This pattern is well documented. What makes this moment different is scale. More people are affected simultaneously than at almost any point since the individual insurance market was created. And none of this was unforeseen. The expiration date was written into law years in advance. Policymakers knew exactly when the subsidies would end. They knew how many people relied on them. They were warned repeatedly about what would happen next. Higher premiums, coverage losses, a rising uninsured population. Yet no permanent solution replaced the temporary support. Instead, the system was allowed to revert. The result is not chaos. It is normalization. People quietly lowering expectations, accepting more risk, convincing themselves this is just how things are now. This normalization is the most dangerous phase, because when hardship becomes routine, outrage disappears. People blame themselves. They stop demanding better, and systemic damage spreads unnoticed. This is how healthcare affordability erodes, not through collapse, but through resignation, renewal letters, higher bills, shrinking safety nets. And once people lose trust in a system, restoring it becomes extremely difficult. The impact extends far beyond insurance. When healthcare is unstable, people delay retirement. They avoid entrepreneurship. They stay trapped in jobs they would otherwise leave. Economic mobility slows. Innovation suffers. Security becomes conditional. All of this flows from one question. Is healthcare predictable, or is it a gamble? Right now, it is becoming a gamble. This is not a sudden crisis. What makes this situation more complex is that not all Americans are affected equally. The impact depends heavily on where you live. In states with large individual insurance markets, the shock is magnified. Millions of people in places like Florida, Texas, California, and Georgia rely heavily on marketplace coverage. When subsidies disappear, the effect is not spread thin. It concentrates. In some regions, nearly every enrollee received financial help before. Now, many of those same people are exposed to full market pricing. This is especially dangerous in states where insurance competition is limited. Fewer insurers mean fewer choices. Fewer choices mean higher prices. When subsidies vanish in these environments, there is nowhere to escape. This is why people in certain areas are seeing premiums rise faster than the national average. And this is where another misconception breaks down. Many people assume insurance companies are simply increasing prices out of greed. But the reality is more mechanical. Insurance pricing depends on risk pools. When subsidies were in place, younger and healthier people stayed insured. That kept prices lower for everyone. When subsidies disappear, those people leave first. Insurers are left covering a sicker, older population. Costs rise. Plans narrow. Premiums follow. This is not a moral judgment. It is math. And math does not negotiate. This is why experts warned that letting subsidies expire would trigger a self-reinforcing cycle. Not immediately, but steadily. And once the cycle gains momentum, intervening becomes far more expensive. Another overlooked consequence is how this affects small businesses indirectly. Many small business owners buy insurance on the individual market themselves. When their costs rise, business decisions change. Hiring slows. Expansion pauses. Prices increase. Healthcare costs quietly ripple through the economy, not as headlines, but as friction. And friction slows everything. Then there is the effect on early retirement. Millions of Americans plan retirement around healthcare access. They work until a specific age, expecting marketplace coverage to bridge the gap to Medicare. When that bridge becomes unstable, plans collapse. People stay in jobs longer than expected. Others retire anyway and risk being uninsured. Neither outcome is healthy. This is why healthcare affordability is not just a medical issue. It is a labor issue, an economic issue, a retirement issue, and it touches far more lives than people realize. There is also a psychological cost that rarely gets discussed. When healthcare becomes unpredictable, anxiety rises. People begin to fear getting sick. not the illness itself, but the financial aftermath. This fear changes behavior. People avoid preventive care. They self diagnose. They delay seeking help. Over time, this creates worse health outcomes and higher system wide costs. Ironically, cutting support meant to save money often ends up costing more. Emergency care is more expensive than prevention. Late treatment costs more than early intervention. The system pays either way. The only question is when. And who pays first? This brings us to the political reality. Temporary healthcare policies create permanent instability. When coverage depends on short-term extensions, families cannot plan. Insurance markets cannot stabilize. Trust erodes. This is why analysts have long argued that affordability mechanisms must be predictable. When people know what coverage will cost next year, they can make rational decisions. When they do not, they retreat. And retreat is exactly what we are seeing now, quietly, across millions of households. This is why public awareness matters. Not outrage, not panic, understanding. Because without understanding, this moment will pass unnoticed until the damage is undeniable. And by then, solutions become harder, slower, and more expensive. The most dangerous phase of any crisis is when it feels manageable. When people say, "We will figure it out." That is often when systems break. Healthcare affordability is approaching that line, not collapsing, but bending. And systems that bend for too long eventually snap. The question now is not whether this issue affects millions. It already does. The question is whether it remains invisible until the consequences become irreversible. Because once coverage disappears, restoring it is not automatic. Re-enrollment takes time. Health deteriorates. Trust does not return easily. This is why this moment matters. Not later. Now. Because healthcare systems do not fail loudly. They fail quietly. One renewal at a time. One dropped plan at a time. One delayed appointment at a time. Until the pattern is undeniable. And by then, the cost is far greater than anyone expected. When healthcare is unstable, people delay retirement. They avoid entrepreneurship. They stay trapped in jobs they would otherwise leave. Economic mobility slows. Innovation suffers. Security becomes conditional. All of this flows from one question. Is healthcare predictable, or is it a gamble? Right now, it is becoming a gamble. This is not a sudden crisis. It is a slow one. A crisis that begins with paperwork and ends with consequences. By the time the damage becomes visible in national statistics, the cost of fixing it multiplies. This moment will be studied in hindsight as a point where affordability could have been protected or allowed to unravel. Because once healthcare becomes uncertain, everything else follows. Savings feel temporary. Plans become fragile. Confidence erodes. This is not speculation. It is already happening. And the longer it continues, the harder it becomes to reverse. This is not the end of the story. It is the beginning of a new phase, one where Americans must decide whether healthcare affordability is negotiable or foundational, whether stability is optional or necessary. What happens next depends on awareness, pressure, and choices. But one thing is already clear. The expiration of these subsidies was not just a policy event. It was a stress test. And the system is already showing cracks.